Hello, my name is Rachel, and I'm going to be teaching about the Bankart tear. The Bankart tear is a tear to the labrum of the shoulder joint, which is basically a shoulder dislocation. The shoulder is a ball and socket joint, so it's extremely unstable and shallow. The specific ligament that is most commonly injured in a Bankart tear is the inferior glenohumeral ligament. The two positions the shoulder would dislocate at are the head of the humerus when it shifts towards the front of the body, which is anterior instability, or when the head of the humerus shifts towards the back of the body, posterior instability. The sport that a Bankart tear is more likely to occur in are contact sports, such as football or hockey, and any sport that has a serious amount of falling, such as downhill skiing, snowboarding, gymnastics, and volleyball. Signs of injury and diagnosis. So when a shoulder is dislocated, the stability of the joint is compromised. The symptoms are as follows: a repeat dislocation, instability, a catching sensation, aching of the shoulder, if the patient complains of not trusting their shoulder in fear that it might dislocate again, and if the patient places their arm behind their head and it dislocates. An easy way to see if a dislocation has actually occurred is to get an X-ray. However, an X-ray might show the Hill-Sachs lesion, which is an injury to the bone. An MRI is the better way of finding the injury, but a surgeon would want to inject the patient with a contrast solution to officially see the injury. Most surgeries for a Bankart tear are recommended after the first dislocation instead of waiting for a second one to occur. There are a few treatment options for a Bankart tear. The first one would be an arthroscopic surgery. This surgery is the better choice because there is less discomfort for the patient since the surgery is minimally invasive. Along with less pain, the surgeon can better see the entire shoulder, including the cartilage, the rotator cuff, and other structures of the joint. The idea of the surgery is to restore the labrum, the attached capsule, and the ligaments back to the anatomical position in relation to the face of the anterior-inferior glenoid. The process of the surgery is fairly simple. The patient is put under an anesthesia, and then the load and shift test is performed to find out the degree and direction of the stability of the shoulder. A rasp or periosteal elevator is used to repair mobilization of the labrum and capsule, and to finish it off, either a knotless or standard suture anchor technique is used. More often than not, a surgeon would use a knotless suture because it minimizes irritation at the glenohumeral joint. The second option would be an open surgery. The idea of the surgery is the same, which is to reattach the damaged labrum to the rim of the glenoid once the patient is under both regional and general anesthesia. The load and shift test is performed. In this surgery, a deltopectoral approach is taken along with the retraction of the cephalic vein. The last option would be to rest the shoulder, though this process takes much longer to heal and fully be able to return to play. To reduce inflammation, the athlete would be using a sling, as well as enduring physical therapy to regain full range of motion. Most patients who endure a Bankart tear repair surgery are limited on any physical activity for a minimum of 3 months and don't fully return to play for around 6 months from the date of the surgery. Surgeons also encourage early mobility during the healing process to further prevent a stiff shoulder in the patient.